Hi friends, I'm really glad that you've clicked on this video to see what it takes to prepare and pass the Emergency Medical Technician program. I take it the fact that you're already looking online for ways to pass the class, you're a super proactive person, and so you're gonna do great in the course. But in this video, I'm gonna show you sort of the basics of what being an EMT is like and the job opportunities that you're going to have, steps to make your life easier in getting through the EMT program. We will go over job opportunities that are available once you graduate and pass the National Registry of Emergency Medical Technicians exam. What is an EMT? Is it a hard profession? What to expect once you're enrolled in an EMT program? Some tips on how my students have prepared and passed the NREMT. I'm gonna go over a couple of things that you can do if you're waiting to get into an EMT program, like courses that can help you with this curriculum, and then stay till the end because I actually have some words of advice from EMT students who just passed the class on Monday. So who am I and why do I know about an EMT program? My name is Jamie. I'm a registered nurse and I have been a nurse for about 18 years. My background is emergency nursing, but I also worked on an ambulance for quite a few years as a critical care transport nurse. And during that time, I worked very closely with EMTs. And now I am a professor of nursing. I have a doctorate in nursing practice and I teach in an EMT program. I know how to prepare. I've seen pitfalls of what causes students to not be successful in the course. And I also know what it's like to, on the professor end, to see the gaps in what students aren't aware of. So let's start with job opportunities that you will have in front of you once you become an emergency medical technician. You can work on a private ambulance company and transport patients, sometimes from home to doctor's appointments, interfacility transfers, so from hospital to hospital. You can also work with the fire department and work with the paramedics in your city's fire department. So I know a lot of EMT students that I work with, that's kind of the direction that they're heading, paramedic fire. So that EMT is the first step for that. You can also be an EMT in an emergency department in the hospital where you work with the nurses and the doctors to take care of the patients. You have your own scope of practice and that is a really fun job, but usually you need to have at least 6 months of experience working on an ambulance before you can get hired into a hospital's emergency department. Some of the EMT instructors that I work with are lifeguards, and then when you are a lifeguard and you get your EMT, your scope of practice just widens and your opportunities increase. And lifeguards monitor aquatic environments like oceans, pools, lakes, and water parks. They ensure the safety of swimmers and people that are around those areas. So they definitely need basic first aid skills, and having your EMT will be great if that's the profession that you want to go into. Lifeguards also perform water rescues where they have to have those skills of an EMT, basic life support, first aid skills. So having your EMT is really important if that's the field that you want to go into. As an EMT, you can also be an instructor for CPR, basic first aid for companies, resorts, on like filming sets. Okay, next point in the video. What exactly is an EMT? What do you do? And is it a hard profession? So from the descriptions of the jobs that I just explained, you can see that being an EMT, you are a first responder. What that means is that you are typically the first one on scene in an emergency type of event, which means you need to have really good assessment skills and you need to know all of that basic first aid to stabilize a person who is having an emergency or a crisis. So just to be frank, yes, it is a hard job, but it's also extremely rewarding and it's rarely boring. If you don't like to be bored and you need to be outside, and moving and active and interacting with people. This is a really, really dynamic profession, which I highly recommend. A lot of times people get into an EMT as sort of the stepping stone for some other type of career, because this is the beginning of getting into fire, being a paramedic, being a nurse, even, being a physician or a PA. Let me see, what do my students like to tell me that they do? That's mostly it. Yeah, one of my students said that they wanted to be an astronaut and having basic first aid was necessary for that job. So, plus, in my opinion, having any kind of medical knowledge and first aid knowledge is wonderful for anyone within their family system. It's always good to have someone who knows what to do. So what do you need to do to prepare for this class? So what's cool about becoming an EMT is oftentimes you can start an emergency medical technician program without needing to take any prerequisites. There's good and bad to this from a professor standpoint. One, this is a really amazing opportunity for you to jumpstart your career. However, this is a very complex first class in the medical field. And so oftentimes students start an EMT program without taking any prereqs, and then the medical world is like a foreign language. And so the new EMT students are learning all of these assessment skills, technical skills with words that they aren't very familiar with. So later on in this video, I'm going to tell you how you can kind of prepare for this. In order to work as an EMT, you need to have a driver's license, you need to be 18, and you need to have a high school diploma. Now, depending on where you live, sometimes you can concurrently take an EMT class in your senior year of high school. So there is that option, but you'll have to find out if that applies to where you live. You will need to have a stethoscope, a manual blood pressure cuff, not one that has a digital reading. You need to have a watch with a second hand. Now, all of us, these days have these digital watches or Apple watches, smart watches, but having a second hand when you're learning how to count pulses and respirations is actually helpful, and some schools require that you have that. So you can get them pretty cheap on Amazon. Just make sure it has a swiping second hand, okay? You need to have BLS, basic life support, so CPR skills from American Heart. You will need to have liability insurance and get the basic EMT liability insurance. You'll see all of this in the syllabus for your program, but the reason why I'm telling you about it now is because you'll start the EMT program thinking it's a normal college class, and it's just not. You've got to be ready with all of this stuff beforehand. The next thing that I want to talk about is the vaccine requirement that you have to have in order to do your clinical rotations as an EMT. So this is something that you want to start way before class starts, because once you're in class, you're going to be busy studying and getting all of these vaccines uploaded and cleared, or if you have to start a series, can be very stressful for the EMT student. And remember, this video is on how can you be successful in the EMT program. So the vaccines that you are going to need. So the vaccine process is as such. You will have to go, well, let's start at the beginning. When you were a baby and a child, you got certain vaccinations at your pediatrician's office. So now you need to prove that you had those by way of a titer. So a titer is a blood test that shows that you have antibodies to certain disease processes. You have to submit those titers to your school and to the organizations where you're going to be doing your clinical rotations in EMT school. A titer shows that your body has made antibodies to the various diseases, and you will have to, and it has a certain range that says that yes, you are immune to this disease, or no, you are not immune, and if you are not immune, you have to get those vaccinations over again. So the vaccines that are required for doing a clinical rotation for an EMT program and whenever you go to work in a hospital are your measles, mumps, rubella, varicella, or also known as chickenpox, hepatitis B, which is a series of 3 shots, tuberculosis, and depending on what school you go to, you might have to have a 2-step TB test, which means that you go and have a TB test, which is when they put that little bubble on your forearm, you know, right here. And then you wait for 72 hours and you go back and have it read by the nurse. And then for a 2-step, you have to have it done again within like a couple of weeks. Every place sort of has their own parameters, so make sure you check your school for how long in between the first TB test that you have to have the second one. But you want to get these done. And if you know you're starting an EMT program, then you probably want to get it done before school starts. You also have to have a tetanus shot within the last 10 years and the COVID vaccine. The requirements for COVID vaccine up until now has been you have to have the 2 main COVID shots, or 1 if you have the Johnson & Johnson, and then 1 booster. So you will have to find your records of that and submit that also to your school. You will need to have a physical examination. Your school will have a form for you to fill out, and you can get that done at your primary care office or at like a minute clinic if you have those around you. And oftentimes your school will have a student health center and they can do the physical exam there for you at a pretty reasonable price. You can also check out your school's health center because they can draw your labs and administer some of the vaccinations should you need it as well. You will also need a background check. You will also have to do a drug test. And so when it comes to taking a drug test, it's a 10-drug screening. A question that I often get from students or people in general is, what about marijuana? Since marijuana, at least in California, is legal now, but it's federally illegal. So you cannot test positive for marijuana and continue in an EMT program. Okay, what can you expect once you're in the course? Let's talk about the theory that you will be learning about. So theory is like what we consider didactic in the world of college courses. And you are gonna have a lot of theory. In fact, in the program I teach in, we cover 46 chapters in 16 weeks. That is a lot of content. It's really intense. It's medical in nature. So there's a lot of terminology that you will be learning. You will learn everything from head to toe assessment, every body part assessment. You will learn logistics. You will learn about system processes and communication, body mechanics, and lots of skills, which I'll talk about in just a second. So we cover head traumas, spinal traumas, OB emergencies, environmental emergencies, toxicology emergencies, geriatrics. We do disasters and mass casualty incident preparation, how to operate an ambulance and the gear that will be on the ambulance and the rules that go along with carrying out orders and giving medications. And then we move on to skills. So skills are actual technical skills that you learn and that you will be performing once you are an EMT. And we start with the basics: vital signs, airway, assessment. We do trauma skills. We do lift and body mechanics skills. We do spinal motion restriction, delivering babies and OB skills. We do splinting, CPR, mass casualty incident management, and how you would treat patients. And we review the approved medications that is within the EMT scope of practice, which are aspirin, Narcan, or glucose gel. The medications are county specific though, so depending on where you go to school and what county you live in, the medication rules and scope may be different for you. So if you're just starting and thinking about doing an EMT class and you have time, I would suggest that you take a medical terminology class, and possibly a pharmacology class, and an anatomy class and physiology class. So sometimes there's a combination of anatomy and physiology. You don't have that as part of your plan and you just want to take the EMT right away. Review some stuff online or get the textbook and start reading ahead of time, because there's a lot of modules and reading that you have to do in this class, plus studying for the skills. It can really get away from you. There are a couple of different ways that you can become an EMT. There are courses which are like crash courses over a 9-week period of time, or even just like a 4-week summer class. It's the same content that's required for a 16-week course. So if you're just starting out, I would not recommend one of those crash course EMT courses, because you need to give yourself the time to be able to study and learn all of these skills. If you've taken an EMT class in the past and maybe didn't pass it, then it would be appropriate to take one of those crash courses because you have sort of a foundation already. Many of my students use an app on their phone called Pocket Prep, and that seems to help them pass the National Registry Emergency Medical Technician exam. It has like thousands of questions and scenarios, and I think you get unlimited once you pay for a month or two of it, and then you can cancel it once you pass your exam. I asked them if they would be willing to give me little pieces of advice for my video that I was making. And so some of them wrote down little pearls of wisdom that I will share with you. Have some knowledge of anatomy and physiology. You get what you put into it, and don't give up on yourself. Read ahead before lecture and read all of the skill sheets. Find a good group of people in class to study with and to lean on. There will be times when you want to quit, but everyone else is going through the same thing with you, so stick together. Don't be discouraged and don't be scared to ask questions. Everyone is here to help you. Hold on. This one I had to put my glasses on for because the writing is so small. Be ready for this class to consume your life for a semester. All you will think about or do in your free time is study for this class. Learn to love the process of spending time learning the material outside of class and create a good study habit. I am so much more sure and excited to continue my career in EMS after taking this class. The instructors are here to help you and support you to reach your goals. The EMT class does eat up a lot of your time. Be ready to study and come to class prepared. This class is doable and will push you, but if you do what you're supposed to do, you will get it. So I hope that these tips helped you. If there's anything else you would like me to elaborate on, please leave me a comment. I am just starting out making these videos, trying to help people in the beginnings of their careers. And so sometimes I might not know exactly what you guys want. So feel free to ask me any questions, and I will do my best to make a video to answer it for you. Okay, thanks for watching.